and welcome back to our presentation on vestibular rehab from a therapist's perspective. Again, my name is Dr. Jacqueline Gomes, and today let's try to get an understanding on what could cause some of the disorders of our vestibular system, as this would be important to be able to choose the correct treatment approach. So one of the most common disorders of our vestibular system is called BPPV, benign paroxysmal positional vertigo, where with the change of position, the patient gets a spinning sense of vertigo that lasts for about a few seconds. BPPV is so common that we're going to devote a whole lecture or two on it, so we'll just keep that aside for now. Okay, besides BPPV, what are some other causes that could have a patient end up having a unilateral stable vestibular loss? What we mean by that is the patient has a one-time episode of significant dizziness which lasts for a while, but it's not repeated episodes and it's not progressively worsening. It's a one-time cause, so that causes a stable unilateral vestibular loss. Again, one of the most common things that causes that is a virus that affects the vestibular nerve. That's called vestibular neuritis. If it affects just the vestibular section, it's just the vestibular neuritis. But sometimes it can go ahead and affect the vestibular part as well as the cochlea. That's the entire labyrinth, and that's called labyrinthitis. Sometimes it could affect the artery that supplies the vestibular system, so that could be a vascular cause, and at that time the patient does present with dizziness just like he would if his nerve was affected, but at this time he also could have one of the following, like uncontrolled high blood pressure or diabetes or obesity or atrial fibrillation, and it will be very important for the doctor then to find out all those medical reasons, to check those out so that he doesn't go ahead and have yet another stroke. Okay, so in this case where the patient might have this that we call a stable unilateral vestibular loss, the presentation is the patient goes to bed feeling just fine. There's no other presenting factor earlier most of the time, though sometimes with neuritis, 50% of the time, he might have like an upper respiratory viral infection or a GI infection a few weeks before. It's not always easy to find out whether that was a cause, but it could be in his history. But nonetheless, he goes to bed feeling fine and then wakes up in the middle of the night or the first thing the next morning, and he's significantly dizzy to where he might not even be able to stand up. Also has nausea and vomiting, sometimes ends up in the emergency room and has all kinds of tests given to him. A lot of times he's found to have vestibular neuritis, and at that time the doctor might put him on prednisone, a steroid to help calm down that infection, and also he could be put on like benzodiazepines or an antihistamine. It's important to remember that if he's put on medications, those medications are to be taken only for the initial 3 to 5 days when the patient is just acutely dizzy and any movement makes him sick to his stomach and he cannot function at all. But beyond those 3 to 5 days, it's important to try to start weaning off of those medications and to try to move in order to help the system to compensate. Also beyond that, what has been proved is that vestibular rehab therapy is very beneficial to help the patient's system to compensate so he can function again back to his prior level. So besides these stable causes of vestibular disorders, sometimes there can be unstable progressive causes, and those are to be detected too so we know what we are dealing with. One of the main ones that could cause an unstable progressive cause is Meniere's disease. With Meniere's disease, a patient has repeated episodes. It's not a one-time episode. He has one and then he could have another like 2 or 3 in a month or in a few months. It's a different pattern for everyone. Besides the dizziness though, he also has like a roaring sound in his ear and a loss of his sense of hearing during the episode. So vestibular rehab therapy does not help with Meniere's disease unless he's had so many episodes that in between episodes he also has a sense of balance or dizziness. It can help up his system up a little bit in those causes. Some of the other things that could be causing an unstable progressive cause could be if he has a tumor on his vestibular nerve or any bony deformity. So again, it's very important to try to find out what's actually causing the dizziness so that the treatment that is selected would be appropriate. So now that we have some understanding on some of the disorders of our vestibular system, let's get into our next lecture into the most important part, and that's the actual vestibular rehab. We'll see you soon.